Okay. Okay. Let's go. So same, you need to go for introduction. Then you will go for, when you come into the station, you will see few things. The depressed patient will look down. Means this is can you can get an idea that this station would be what. For example, if patient look down and or when you just introduce yourself, for example, sometimes it's very difficult, sometimes it's possible that you can guess from the patient that what station would be. When you get into the station and you say, hello, my name is Dr. B, may I confirm your name and age, please? So you will see a patient talk to you and look down, okay, and the withdrawal body language he's not using. That means this is depressed patient, means this station will more likely goes to depression. And for a psychosis patient, what station has been counter most of my colleagues or most of my friends whom I know, they said the patient was irritable, not even worried, but irritable means the patient was even walking. The patient was like, you means not, patient was restless. For example, he was sitting, but he was like shivering, he was moving around. He said like that. And I also find once I had a station. So this would be like that. The patient will be irritable, not sitting well in one place, or maybe the patient is moving around in the room, or if he's sitting or she's sitting, she's like shivering, something like that. An unusual moment you will find in a patient. So that means this that person indicate like this patient might be goes to psychosis or has psychotic problem, and station goes to psychosis. Next is many patients, she will be excited. When you talk to her, hello, my name is, may I confirm, she will be very loud. Her volume will be very high. For example, she will say, yeah, my name is Vivian. I am very happy person, or anything she will explain you. Oh, I'm 32 years old. I mean, she will use a extraordinary activity, like she will show you a lot of happiness from her volume and also from the body language. Okay, she will use her hands. Oh, I'm very happy. I'm excited to be. I always excited. Or my name is blah blah. My age is this. So from body language you can understand. So the money patient. Then other is anxiety. Anxiety is usually normally responds to you, and she can understand everything what's going on around her. Next is a self-harm. Self-harm always come with the depressed, but sometimes, as I said, you can have the patient overdose, which is relevant to toxicology. Anyway, we will come up to this station later. Okay, so depressed patient, first you introduce yourself. When you get to know the patient name and age, she will look down and she will say, yes, my name is Chloe, I'm 36. Then when you will, first you need to make her calm, like establish a good environment for her, and also you need to explain the purpose of meeting. So for example, you say, I have been told that you came to the hospital. That's what I said. These are the communication skills, show you how you communicate with the patient, how you start the station. This is very important. So you can start with different ways. Everyone have different ways to start it. So, but I just added what I think. I have been told that you came to the hospital because one of your friend worried about your mental health. Or you can say your daughter is worried about your mental health, or your husband, etc. So this is for depressed patient. If you found a psychosis patient, you say, I have been informed that you are worrying about something, or worrying about your safety at home, okay, etc., or safety at your work. Is that correct? Means this is a way you can start the station. Mani, what has brought you here today? Just simply say what has brought you today here, or what has brought you here today. Anxiety, the same way. But the self-harm, I have separate table. I will show you later. Okay, so what else she said? You have to empathy. I'm really sorry to hear that. And you go for, could you tell me a little bit about how you've been feeling? Here, now from here, I'm going to focus on depression station, okay? Keep in your mind. These, I already written these stations separately. I will show you how we take the history in psychosis. I have one more slide for that. I just put these 4 in because this is the beginning, so I just put it. So for what you have to focus now, patient will look down, you found this is depressed patient, you will go for, I have been told that you came to hospital because one of your friend worried about your mental health, then you will go empathy. I'm sorry to hear that. Then you will go for could you please tell me a little bit how you've been feeling? This is not for every station, but in depression, very, very common to say, could you please tell me a little bit more about how you've been feeling? How have you been feeling recently? Patient will say, I am feeling bad. Okay. If the psychosis patient, maybe this is also for psychosis, is really stressed and worried, I'm feeling absolutely great, fantastic in mania patient. Okay. And excuse me. Yeah. And I'm just struggling with the anxiety. So anxiety patient will answer you that. So after that, after you find that, then you will go for a connector, like say, okay, Miss Chloe, I have to ask you a few more questions. Would that be okay for you to better understand your mental status? This sentence you have to add by yourself. Okay. Then you go for depression question. So once you got the station is depression, so you need to start with the depression question first, instead of psychosis or self-harm. So if you found the station as depression, then you will go for how long that have you have been going for, how long have you been feeling that way? Okay. Is there anything particularly going on recently? So patient might say, yeah, I'm very sad because I lost my job. Maybe she said about her job. I really like that job. Maybe she will explain you, my friend left me. I broke up. Several things she will tell you. There are many reasons behind it. So is there anything particularly going on recently? Maybe she will tell, in this question, she will tell you that what has happened, why she is depressed. Maybe because she lost a job. Maybe she lost someone whom she was loving, or she broke up in a relationship, or she is sad about other activities in daily living. So this question can give you idea what was the cause of her depression. Another, I guess there is a lot going. Once you got the answer, then you use a connector, a connective sentence. I guess there is a lot going on. Have you been able to do anything that you enjoy? So this is also a question relevant to depression. Have you been able to do anything that you enjoy before? Or are you able to enjoy the things that like before? So keep in your mind, when you ask a question, try to use the connector. Don't go, are you enjoying the things as like before? Not jump up. Better to, in psychiatry, they also test your communication skills. So better to use the connective sentences that to make everything clear. One more thing I want to tell you, which is very, very common question. When you will go, I just stop it here first, okay? When you go inside in the station, you will find examiner. Examiner have two things in the hand. One is iPad, okay, tablet, or the examiner will have the book or the paper. So the Mrcem always give them a specific chart, okay? So what question you are going to ask, they will give you the score according to that chart, okay? For example, if they mention the depression and they mention the question, so you will get a score on the basis of that question, and they will tick it. For example, You ask the depression question, they will mark it. Okay, one is score for that, this question, another score. So this is how the Mrcem made everything for the examiner. So try to use a good communication skills, not only in the psychiatry station, in all stations. I guess there is a lot going on. Have you been, are you able to enjoy the things as like before? So she will say yes or no. If depressed patient, she will say no. Okay, sleeping pattern, you need to ask her about, have you been sleeping? Or you can ask her, how's your sleep? As long going on, is a lot going on around you, have you managed to look after yourself? Because depression patients usually doesn't look after themselves because they think like that, they lost everything. Okay, they have very low moods, so usually they don't. Eating habit, how's your appetite? Or have you been eating? Like this kind of question you can ask a patient. And also substance use. Substance use is a very, very important question in depression. So you need to ask this question here. Sometimes when people are dealing with such situation as like you, they try drugs or alcohol in a way of coping. Is that something you tried? Okay, listen to me, guys. Don't need to exactly follow what is written here. You can create your own sentence. There are different ways to communicate with the patient. So if you think that this sentence is okay, you can use it. Or you can create the simple way, the one you like. Okay. Once you ask the depression question, then you know that the depressed patient likely have the self-harm, okay? Risk of self-harm. So the next you need to ask a question about self-harm, then psychosis, then cognition. Okay. Once you ask this question, then you come up to self-harm. So you need to ask things that have felt that bad you have been thought try to harming yourself, or have you ever tried to harm yourself? Okay. Or you can say there's a lot going on you. So sometimes some people try to harming themselves. Is that you did? Is that in your case? Like you can ask this way question. Or have you tried to harm or others, harm yourself? Okay, you can ask this question this way. Then if she say yes, so what is that thought about doing? Or what were you trying to do? Maybe patients say I was planning to take the paracetamol. Maybe I was planning to take aspirin overdose, maybe the medication. Maybe she was trying to do another harmful activities, or to jump from the flat or anything what she else said she can tell you. Have you written something or informed anyone before harming? So when patients say yes, then you go for this question. If patients say no, don't go for further question, just stop it, okay? And then you go, the last question you will ask, have you thought about hurting or harming anyone else at any point? About others, okay? So what happened usually, depression patient likely harming themselves. Not everyone, but if you find the station is that, so this, I will tell you how you manage if the patient has self-harm. Then you go for psychosis. So here, one or two questions. Have you been ever worried that someone interrupts your thoughts? Then if she said no, then you go for, okay, sometimes people feeling in that way you are now, they might hear or see something abnormal, which cannot be explained. Have you experienced something? This is a connector sentence. Sometimes people feeling that way, but you can ask another way. Have you experienced something which other people doesn't see or they hear? Have you experienced such kind of things? Or you can say, did you hear any voices which other people cannot hear or cannot say? You can also ask like this way. Or here I mentioned already, do you see or hear something abnormal which cannot be explained? So you can ask different ways. So one or two questions from psychosis if the depression station is up. Do you know where are we now? What time is it? Who am I? You can add it. And the last one is, what do you think is wrong with you? So guys, these all questions are relevant to mental state examination. Okay. what I want to say is all questions are relevant to mental state examination. I would say, 1 second, I haven't mentioned here. Explore the patient. So, mental state examination. So, guys, what I mean by mental state examination? These are the questions. I want to mention that. So, what's happened sometimes? Candidate got confused when they mentioned the scenario, a case, and they say task, assess the mental state examination, or do the mental state examination and take a history. So people get confused. What mean by mental state examination? This is just one. Okay, clear so far about mental state examination, guys? Yeah. Okay, so these all questions are relevant to mental state. And the same, this questionnaire has been using by psychiatric, the doctors which are working in psychiatry or their specialty is psychiatry. Okay, so then you will go for the further questioning that I need to ask you a few more questions. Is that okay? Did you have any mental or psychological problem before? Any past medical history, surgical history? Where do you live? Whom do you live with? What do you do? If you already ask about the substance use, you don't need to ask these two questions, okay? Closing consultation, do you have any question? Okay, done. After that, then you have to present mental state examination finding to the examiner. So this is very, very critical stage. Once you take short history and do the mental state examination, after this examination, you need to go for the present finding to examiner. So the important in psychiatry station is two things, only two things. One is the mental state examination, and other is presenting finding to the examiner. These two stages are very, very critical. Your most score come from these two places. They don't care about your clinical decision. Even you don't tell the clinical decision, or you forget to tell, or the station is over at the mental state examination, you will still get the highest score. So you don't have to worry, because in the task they mention you take a history and do the assess the mental state of the patient, or do the mental state examination, take a history, and present your finding to the examiner. So you did three things. History is very short. You say you are going to ask only past medical, these past psychiatric history, past medical history, family history, social, very few questions, and then close consultation. So the important are the only mental state examination and the finding to explain the examiner. So these are very important. So let's come up to, I write down already here to make it easier for you, that you can just verbalize it, or you can just memorize. It's very, very easy and very simple. So today you will go to, once you finish your consultation, then you will go to turn to the examiner, look at the examiner. Today I assess Colin Russell, a 38-year-old male presenting with low mood, okay? Because the depressed patient always present low mood, and if he has suicidal ideation, you also need to mention that. In suicidal ideation on the background of significant social stress. Social stress means maybe he dropped out from his work, okay? He lost his job, or other problems could be, so you can mention. For the last couple of days, he's struggling with this suicidal ideation, trying to harm himself with paracetamol. If he said, I was trying to take it. If he said another things, you need to mention that, harm himself with knife or any other things you can mention, whatever the patient say to you. He says that his family and friends will be better without him. So guilt and worthless is very, very common in depressed patient. So on examination, then you would mention, on examination, he appears sad and cheerful, if he is cheerful, with poor eye contact, with the evidence of psychomotor retardation. Then speech, you will comment on the speech. Colin speaks slow and monotonous, or that means the tone is toneless speech, okay? Or we can say the variation of tone is there is a variation in his tone. So the lack of variation, sorry, means only one straightforward, like sad all the way in communication. So lack of variation in his tone, that means monotonous. Okay, mood and effect, and he described his mood as low with evidence of an near poor concentration in early morning waking. So the thought and perception you will, if he has, so you need to say, Colin described moods, congruent helplessness and guilt. He denied any perceptual abnormalities. For example, when you ask him, do you see or hear anything? So these are the perceptual abnormalities. So if he denies, so you need to mention he denied. Cognition, Colin was oriented to time, place, and person. Insight, judgment. Colin demonstrated partial insight, but he doesn't believe that his cognition of the guilt and helplessness could be related to his mental heart disorder, because as I said earlier, the depressed patient usually represent the guilt and also the worthlessness. Risk, in terms of risk, Colin repeated ongoing suicidal ideation and planning to take paracetamol overdose. He denied any thought or intent from other. So it's not necessarily that you pick up everything, but whatever you can pick up from here, what I put in the finding. So this is very important. Usually the patient presents these findings. So you can write down in your paper if you have time to, and also memorize that's what has been written, because when you take the history, you also need to speak very fast. So you need to pick up a few points, not everything. If you think you are good enough, you can pick up entirely, because it will give you the, as I said earlier, that the examiner have a chart and they give the score according. So on examination, examiner will think, did you comment on appears? Did you comment on patient behavior? Did you comment on speech? Did you comment on the mood and effect of the patient? Did you comment on thought and perception? Did you comment on cognition? Did you comment on insight and judgment? If you miss any one of them, you will lose one score. So this is what I want to say. In psychiatry, in every station usually, but in psychiatry, each everything is very important. The most important thing, I said 2 important points. One is the present finding to examiner, another mental state examiner. Rest you think forget 1, 2 point, no problem. These are the most important. So you need to memorize very well these 2 parts of the psychiatric history. And also I clearly mentioned and highlighted very well appears, what you need to comment on appearing, what you need to comment on behavior, what you have to comment on speech. So it all depends on all stations. You need to follow that. Okay, so this is about the complaints. If you have time, you also need to go for the management plan. So usually they don't ask you to comment on management plan, but if you give that would be great. So let's come up to the management plan. So sorry. Okay, so what is the management plan for this guys, for depression patient? Anyone? I have slide for that, but I want to tell you, if a patient with the low risk, I will tell you there is a special score we're taking, but anyway, you just need to one thing. A patient present with the self-harm, that means high risk. This patient really need admission under the mental health service team, okay? You don't just need to comment, this patient is high risk and I need to admit this patient under the mental health service team. psychiatric assessment. Anyone can tell me what is psychiatric assessment, guys? What mean by psychiatric assessment, guys? Anyone can tell me?
The patient will be seen by psychiatrist.
Okay, okay. So what a psychiatrist will do, actually, psychiatric will do the same mental state examination. We refer this patient to psychiatry due to a few reasons, because CBT, okay, cognitive behavioral therapy or counseling, is given by psychiatrists, not by the ED. That's why we refer this patient to them. Okay. Anyway, he's a low risk or the high risk. We will refer this patient to the psychiatric specialty for the treatment, for cognitive behavioral therapy or counseling, and also for the need admission or referral, what possible, or follow-up, because we cannot give this treatment to this patient from ED. So this is a job of psychiatry. Regarding assessments, the assessment is the same as we are doing in the ED, mental state examination. They will do the same. Okay. Once we did, they will.
So in both cases, we have to refer patient to the psychiatric team.
Yes, they both.
Either he's low risk
yes.
or moderate.
Yeah, in both situations, we need to refer, because the cognitive behavioral therapy also need to given by them or given by the general practitioner, which who has skills on that. Not every doctor. Clear? Both cases need the mental health service team intervention. We cannot do it, because if it's low risk, he needs CBT, the cognitive behavioral therapy or counseling. Counsel we can do, but it will not really successful. So the moderate or high risk, he need admission. Okay, the high risk and moderate risk, always a patient has the risk of self-harm or to others. We will come up to the management of depression later in the next slide. I will show you. Okay, so
Doctor.
Hello. Yes.
Yeah. To assess the sad person score before commenting on low risk or high risk.
Sad person score coming up to the this is self-harm station. Okay. Self-harm station, okay. Not in the depression. Okay. Let's come up to psychosis. So psychosis is the same way. This is another slide. I made it. I make separation because I don't want you guys get confused. Maybe my teaching way is a little bit complex to get you understand, but overall, when you go with by yourself, maybe a lot easier for you. Anyway, so same introduction. So, because here I mentioned this about psychosis. Okay, so station is psychosis. You will say the patient will be irritable or worried, then you will go for the next one. I have been informed that you are worrying about something, or you're worrying about your safety. Once you find the patient is, the station goes to psychosis, then directly go on this, explain the purpose of meeting the patient. I have been informed that you are worrying about something, or worrying about your safety. Guys, don't use how can I help you, okay? It doesn't make sense. Okay, in most of station in psychiatry, it doesn't make sense. Like, if patient is depressed, how can I help you? It doesn't make sense here. Okay, you need to create environment for the patient. You know, if this patient once you introduce, you found a depressed patient, then you need to support the patient, and you need to explain purpose of meeting. That patient should talk to you, communicate with you. If you ask, just get in and introduce and directly go to the open question, he or she will not respond to you. And this is not a good way of communication either. So you should be very careful. I have been informed that you're worrying about something. You're worrying about your safety at home. Is that correct? Okay, I'm really sorry to hear that. Can you please tell me a little about how you've been feeling? Okay. Because psychosis or depression, but thing you need to ask the feeling. Then patient will say, it's really stress or worried. I'm really stressed at the moment. I'm really worried about something. Maybe patient will show you, ask you, oh, look at the door, there is something. Maybe if patient is saying something, it means hallucination, okay? Perceptual abnormalities if patient has it. So it's two kind of patient you can have in psychiatric station. One, maybe patient have perceptual abnormalities. Patient will say, I see something, there is near the door, maybe the visual hallucination. Maybe the patient have thought problem. I think somebody getting thought in my mind. I'm feeling like somebody inserting thought or taking away thought. I'm hearing some voices. So you can see, you can find the patient maybe explain to you about what he's worrying or what he's feeling. Okay, thought content possession abnormality. So then if the patient say, I'm worrying, I am stressing out some things, and then you ask a question, okay, what is worrying you? Patient may say, I knew they want to kill me. Maybe he will say, I will be killed by someone. Okay, so then you will go further question, who's that? Who are they? Maybe patient say, my worker, my roommate, my relative, my husband, my sister, anything. Okay, then you'll go for further question. How do you know he or they want to kill you or harm you? Patient might say they want to kidnap me or they are trying to poison me. Maybe he or she will say like that. Okay, so once you find that, then you further elaborate with the question. How did you find that they want to poison you? From question to question, close consultation. Once you find, ask the patient say, I'm hearing the voices. Then you will say, okay, could you please tell me whose is this voice? Who are they? Okay, patient say, I hear the voice, I don't know. Maybe patient say, oh, I hear the voice of my husband. Okay, then you say, what he's saying, what she's saying, or what your friend are saying to you. Okay, this way you can elaborate further. Or if the patient says someone want to kill me, then you ask, who are they? Who is that? Why do you think so he or she harm you? So you can ask further question that. Okay. Another is you can ask, is there any reason you think they might want to hurt you? You can ask further question. And then you come up to thought insertion or withdrawal. Do you feel that someone put thought in your head or taking thought from you? Sometimes people feel that either thought been broadcasting louder, like everyone in the room can hear them. You can add this one, okay? Then you come up to perceptual abnormality. These all are relevant to psychosis question, guys. That's why I mentioned in the red that this is an important topic. The rest of them are subtopics. So, do you see or hear something abnormal which cannot be explained? Maybe patients say yes, what they say, what they talk to you. If you already ask about this in first questioning here in thought content, so you can skip that one because you don't need to repeat the same question. Okay, what is that? What they talk to you, what they say to you. Okay, maybe patients say, they say to her, her name is maybe Liz, and she said, Liz is a terrible, Liz is a nasty, she's a bad person. Maybe he or she will explain to you like that. Okay. Is that to directly talk to you? How many people or persons talk to you? Do you know him or her? The same I already said before. So this is the way you can ask about this question if the patient. So it all depends what kind of patient you're having. Is a patient has perceptual abnormalities or there is another like thought insertion or withdrawn? Okay, so relevant to that. So if you found it perceptual, you need to go ask a question further from first open question, then close consultation. After a psychosis patient, the same way you will go for depression. Okay, with all going on, again, connector, with all going on, have you felt low or depressed at all? With everything that's been going on, have you ever tried to harm yourself? Okay. Or with everything that's been going on, have you ever tried to, sorry, this here doesn't need to be. Okay. Have you ever had a thought to harm others? So cognition, then insight and judgment. What do you think? What wrong with you? Do you think you need a treatment or like this? So you need to ask her the question. Okay, so it's clear so far, guys. I made it very simple now because this is just psychosis question, and then the very short questioning about the depression, self-harm, and cognition. I think very, very clear picture here, right? Okay, then the same you will go for past psychiatric history, past medical history, family history, social history. Okay, close consultation. Then again, you will present finding to the examiner. So background of psychosis, or he present to emergency department, blah, 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 you need to say, and then you appear in behavior, and you will say he appears distressed and anxious. However, he engaged well during the assessment. He was monotonous at time, mood and effect in terms of mood. He appears stressed and worried. He denied any thought of self-harm and other, etc. Thought and perception. Colin described paranoid, psychiatry delusion of belief. That means which is unfounded. Okay. Unfound, which now as his support worker want to poison. Colin has reported auditory hallucination if he has or she has. Cognition, Colin was oriented time to place and insight, and appears lack insight into her substance being related to deterioration. And then you will go for the treatments if required. If they ask you to clinical decision reasoning, then you also tell the treatment for that. So what's the treatment for psychosis patient, guys? They also need counseling and cognitive behavioral therapy. So you need admission or referral to mental health service. Okay. Okay. So yeah, you cannot treat this patient. You cannot start directly to the antipsychotic medication or antidepressant. Okay, so let's come up. So that's why what I said, the RCAM usually focus on two things on psychiatry. One is the mental state examination. Okay. Second is your finding, how you present your finding to examiner. Did you present what you have found? So this is very important. About management, most of cases need the admission under the mental health service team or the referral. Okay, so mania patient, the same way. Introduce yourself, and you will see the patient will be looks excited. And sorry. And the extraordinary happiness would have brought you today. Why do you come to the hospital? And she will explain you. Maybe she will say, "No, I don't have no any problem, but my husband just bring me here." Usually, the patient will answer you like that, because she thinks like that she's fine, she's a great person. So, or he, so usually they give you answer like that. My husband brought me here, and I don't know why why he brought me here. So she will say like that. Okay, could you tell me a little more about how you've been feeling? She will say, I was feeling absolutely great, fantastic. So this is all. And then you will go for depressed question. Okay, okay, Miss Chloe, I have a few more questions. Would that be okay? And then you go for it. Okay, how would you say feeling normally? She said, I always feel great. I'm always fine. Maybe she will say like that. Sleep pattern. How have you been sleeping recently? She said, yeah, I little bit disturbed in sleep, but overall I'm great. I'm feeling great because I have a lot of work to do. I'm great personality. Maybe she will think I have a contact with the NASA. and something she will talk like which is really not exist. Okay. How's your appetite? How have been eating? So after this question, you would go for psychosis the same way, perceptual abnormalities, and then self-harm, then cognition, judgment, insight. Do you think what you're feeling? So this is very important here, inside of judgment, because you cannot ask, do you need a treatment? No, directly, but you can ask like this way. Do you think what you're feeling or saying it's not correct? So if she said, no, it's right, I'm feeling great, that means she doesn't have insight, okay? Do you think you need a treatment? What you're feeling, it's not normal. She will deny it, okay? Next is past medical, psychiatric history, medical history, the same way. Then you will go for today I assessed, blah, 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 examination, she appeared, blah, 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 and kept animated, frequent. And also the speech, her speech was rapid at time, increased volume, the same about perception, cognition, and again, insight and judgment. So she also need a mental health team, okay? So if even you don't, if you want to give the treatment plan on your own, so what you will say, guys? So what's the treatment for mania, guys? Anyone can tell me? Anyone can tell me the treatment?
I think it's the same.
Admission also.
All psychiatric cases should be referred for the psychiatrist.
Yeah, that is correct. But you also need to, in case you need to, I think mania patient can be managed now in the ED also. It's not exactly necessary for psychiatry, but if you mention that would be great. So what's the treatment usually we prescribe the mania patient? Any medication, if you remember?
Lithium.
Yeah, that is it's been avoided now, but it was. So the oral antipsychotic medication we give to haloperidol or olanzapine, quetiapine, so these all medication we give. But for the purpose of exam, better to say the psychiatric mental health service team, admission under the mental health service team. Okay. Okay, so next station is anxiety station. So anxiety station is not very common, but you can have it. Anxiety patient always responds to normally. You will not have any problem. And the same question, what has brought you here today? I'm just struggling with anxiety. I'm sorry to hear that. Then you will ask, what mean by that? Could you tell me a little bit how you've been feeling? The patient will say, my heart is racing, sometimes feel sweaty. Then you will go for anxiety question. The problem is anxiety patient is that most of people have the panic disorder. Okay. So you will ask a few questions like, how long that have been going for? Is there anything particular? Maybe she will mention, there was a car accident. Okay, because anxiety is always due to some incident, right? When patient these thoughts came in mind, when patient think about those things, bad thing or which has been done in the past, or they have recently encountered any serious incident, so patient likely to suffer with anxiety. So maybe patients say, yeah, my friend was with me and they had a car accident, she died in front of me, and I can tolerate. After that, I'm feeling that, whenever I think about that. Okay, then you'll go for anything particular you worry about. Is there any situation that cause you to more worried? Yeah, patient might say, yeah, whenever I find my husband go outside, I always worry. Maybe I worry that maybe he will have a car accident, because these are the frequent thought to come in her mind. So frequent worrying. Anxiety patient always worry about the same incident, about if has been encountered in the life. Anyone, for example, if a car accident, if someone who loves her or children or any family member go outside to drive a car, she always worry. Maybe she will worry about them. Maybe she will have a car accident. So she, in real time and practical time, maybe she always try to call him or her. Oh, are you okay? Are you arrived safely in the school? Okay. Are you arrived at work safely? How are you? Like frequent asking question. Even there is nothing to worry, right? So relieving factor, is there anything that help you to calm down? Maybe she will say, yeah, whenever I watch movie or whenever I do watch some comedy to divert my mind, okay, watch movies, or when I play games, it's divert my mind, I don't feel that. Okay, then you go for panic attack history, which is very common in anxiety patient. Have you ever had a panic attack? Okay, you can ask her. Okay, impact on daily living. How has it been impacting your daily activity, all of these anxiety issues? Yeah, it's really affecting my relationship with my children, my family. They always think something wrong with me, why I'm asking them all the time. So this can be possible. Sleeping pattern, have you been sleeping? How's your sleep? Maybe she said, no, not really. There's a lot going around you. Have you managed to look after yourself? So yeah, some of them can look after, some of them no. Okay, the same as usual, depressed question, self-harm question, substance use. This is substance use very common in an anxiety patient. So you can ask them, sometimes when people dealing with such situation, they try a drug or alcohol in a way of coping. Is that something you tried? Maybe she say yes or no in psychosis. Inside judgment, which is usually coming up normal in this patient. Okay. So in the end, there are two ways. Then you will present finding to, if they ask you to present finding to the examiner, then you present finding to the examiner. Okay. So most commonly present finding, I had never heard about like to management plan, but it can be. If they ask you, don't ask you present finding to examiner, then you go for a management plan. Okay, so what is the management plan for the anxiety patient, guys?
Anti-anxiety.
Usually, this patient can be discharged from the ED safely. Normally, patient, if doesn't have any self-harm or any, because this patient is not very complicated. I mean, he or she will not have this a lot problem. She just need a diversion to cope with the problem which is what's going on around her. So she requires self-help. Self-help, what we do, we give a printed leaflet to the patient, and there are different strategies to cope with this condition. And I will share in the group also this link, and you can find it. So most likely she will require the self-help. We give a printed leaflet where it's written, first of all, she will think why she's having this problem. Then she will make a plan how to cope with that. She need to recognize why she's having problem, why not others. Like this kind of leaflet we give to this patient. And also there's another way, computer program. So computer program have a special program where she can watch it and she can treat herself by herself. I mean, to follow the strategy and to avoid these old problems. So this can be safely discharged. Anyway, if you think you cannot, you can say she will be admitted under the mental health chain. But overall, I will send you the link in the group, and you can check out how to treat this patient. So that's what I say. What I want to say, so she can take a self-help, and also there is computer programs which can give her, she can watch around 5 to 4 sessions per week. Okay. If she doesn't progress, then we have psychological therapy. Psychological therapy, which is given by the psychiatrist, called CBT, cognition behavioral therapy. There are the session around few sessions in a 3 or 4 month. Okay, it depends. And also sometimes we give a medication, the antidepressant called serotonin reuptake inhibitor, SSRI. So This medication also in severe cases we recommend. But for the purpose of exam, you will not have a lot of time. So you can just say the admission under the mental health team. But if you have time, you can explain. There are different ways. One is you can just say, yeah, she will need a self-help. I will give her a printed leaflet for that. And also she require cognitive behavioral therapy, which will be done by the psychiatrist. So I will refer her to that. And so they will decide if it's severe case and maybe she will require medications. You just need to mention that, show the examiner that you know how to manage. Okay, so this is about the mania patient, anxiety. Okay, so the next is about self-harm. This is also a very common station, but in different ways usually come up with the toxicology, the overdose of the paracetamol or the medication. Usually this is stations like that, paracetamol or the aspirin or calcium channel blocker, or come up with the iron overdose. Previous exams commonly came up with the iron overdose. So the same way you need to establish the environment. I just want to have a brief, because this patient is risk harms, okay, self-harm station. So patient usually very calm and cool, and maybe she doesn't respond to you directly. So first you need to give her a nice environment that she feels safe. So you need to establish the environment, then explain the purpose of the meeting. I just want to have a brief chat to see what's been going on, so that we can work out to help you, and if possible to get out of this hospital. If the station indicates you to assess this patient, is this patient safe to discharge? So if relevant to that, better to go this way. Anything that said here today will be confidential unless I feel another person is potentially at risk, in case I would need to share some information. But if you don't say this all sentence, also okay. Just say anything you will tell us would be kept confidential, okay? Then you would go for the open question and explore the present complaint. Then go for the precipitant. Let's start. Can you tell me what happened? Okay. Maybe then she will start like, oh yeah, I took the paracetamol tablets. I had a fight. I had a problem with my friend. I was angry with my friend. That's why I take the paracetamol. Then you will go, why did you take these tablets? Or maybe you just say, before you go, maybe she will say, yeah, I came in a hospital and I want to go home. Then I want to go home and I'm okay. I just took the paracetamol dose. Then you ask her, why did you take them? Maybe patient will say, yeah, I took them because I was angry with my friend. I just take it. Then you will go for the intention, the quantity. Where did you take them? Okay, for quantity, and also the where you got them. So where did you get them, these medication, or where did you get this medication, or where did you get the medication from? Maybe she said, oh yeah, it was in the cupboard, or it was in my room and I found it. Okay, how much of the medication did you take? If the medication, but if it's the cut rest or the other cut marks, so do you have other cut? Do you have the marks in other area of your body? Where did you have the cut marks in like this? Why did you cut your wrist, or why did you harm yourself? You can create your own question. But usually, for the purpose of exam, if we check from last few years, I'm finding usually paracetamol or the iron overdose. These are very common station. So then you will go for, is it planned or impulsive? Did you take it to? Did you plan to take them, or did you plan it to cut your wrist? if it is the harming self with the knife or any other the sharpen equipment. Did you take these tablets impulsive, or that means without thinking? If the patient say to you that I take it just I was angry, then means this is not due she wants to suicide. Okay. So you need to know about without thinking, or did you write any suicide notes? If she said yes, that means she want to kill, harm herself, and that's intentional. Okay, precaution. What protective measure have you taken, like closing doors, going somewhere very remote? And then you go substance use. Did you harm yourself under the effect of alcohol, or did you take this medication with alcohol? Okay. Did you take these tablets with alcohol or any other recreational drugs? Have you ever carried self-harm in the past? Okay. If yes, what method of self-harm were involved in that time? So you can ask more questions. So one, first, the precipitant quantity and the location, the place where she got it, planned or impulsive, precaution, substance use, previous episode. So you will get a score according to this question. Even you ask one question, you will get the score. If you miss any one of them, you might lose the score. Then again, the same question like depressed and self-harm usually also have the depression. That's very, very common. So you can ask for depression question in psychosis. It doesn't require cognition in this station. Okay, the same way the past psychiatric history, family history, etc. And remember one very important thing. I want to come up with that. So, okay, for example, I want you should participate. Okay, I have to ask you a few questions. Please give me an answer. Look, the patient. You have a case, like I have a case. The patient brought into the ED with the paracetamol overdose, and all the investigation came up normal. But the patient would like to go home. Okay, and they didn't mention that what is the level, but they mentioned that your colleague wanted to give the N-acetylcysteine, but she refused. Okay. And they ask you to assess her and check it if she is safe to discharge. So now you see in this case, they say that she refused to take the antidote. Okay. So what you have to do in this case, what you will do in this case, guys, I need to ask you first question, then I want to see your answer, then I will come up to my answer. What you will do, guys, then?
Admit?
Capacity assessment.
Capacity assessment.
Mental health assessment.
Okay, you did a mental state examination, and she said she was angry with her friend, and she just took the medication. She wasn't playing it, right? That means she just take it. She wasn't playing it, right? You did the mental state examination, and her risk set person score you take it is low. Now, your colleague, they also mentioned in the case, your colleague want to give her neck N-acetylcysteine, but she refused to take it, and she just want to go home. So what you will do? She's low risk from
assessment. If she can, capacity
Okay,
assessment, whether she can.
I will check mental capacity and see if she's mentally capable to discharge.
Does she has capacity to make decision or not?
Okay, very good. So you need to check the mental capacity, okay? But one thing I want to tell you, if the patient says she will harm herself, okay, again, or she has intention to harm others, in that case, you need to admit this patient even she wants to go home. Okay, So that is
Yeah.
what you, that is what the Mental Health Act, which is 1983. We have this act I have written in depression management plan, and I will show you. So you will say to that we have a special, the law called Mental Health Act. According to that, I have to admit you, and that would be compulsory admission. We'll come up to that. But overall, if she is a low risk, you check the mental capacity and she has it, and you counsel her that if you do not get this one, it will harm to your liver will be damaged, but still she refuses it, then you need to destroy this patient because she has the capacity. So this station is very complex and always come in the exam. So how to rule out the psychiatric assessment first, the psychiatric problem, you will use the set person score. When you have the case, for example, before you start a station, you will have the case outside of the door. You see the male. If male, that means 1 point. Okay, they will mention the age you need to check out. That means 1 point. If you see this is a girl and the age is not relevant, so 0 point. And when you come up inside and you found how's your mood, and she explained you that her mood is low, she recently found she is depressed, that means 2 points. Okay. And there is, for example, suicide ideation, if she has it, or she is, for example, planning to harm himself, that's mean high risk. I want to make it very short. Any patient who has plan of self-harm and also to harm herself in the future, she needs admission. Don't think too much about the set person score, just go for admission. Okay, why? Because of the Mental Health Act. Clear, guys? I want to make it very simple. Any patient who wants to harm him or herself, or he intend to harm others, go for admission, and that's compulsory according to Mental Health Act. Okay, ignore the set person score. Okay, if she doesn't have, then you need to little bit think about the set person, like you need to find out the score, what would be. So I have in management.
Can you come again? I couldn't understand. Do I have internet interruption? Can you just repeat it again?
Okay. I want to say any patient who has a risk of self-harm means again going to harm him or herself, or he or she is going to harm others, and that this patient needs admission. According to Mental Health Act 1983, I have written this act in the next slide. I will show you. Okay. So any patient with any going to harm him or herself, admit this patient. Not here now. When you ask the question, are you going to harm yourself if I discharge you, or do you have any plan to harm others? We have this question in self-harm. So if she say yes, then she need admission. Even don't need to follow the set person's score. This admission is required due to the Mental Health Act. Okay. So if the patient deny harm to others or harm herself, then you go for set person score, and I'm sure that set person score will be low, and then you can destroy this patient. And if she or he has the mental capacity. Clear?
Yeah, thank you.
It's not clear. I think it's very complex, right? Still not clear. Okay, so
It's clear now.
let's come up to next slide. I want to show you, I have written it. Okay. Next is alcohol. I made a slide for alcohol too, because I want you guys should make the difference. What question should be asked in psychosis stage? What question need to ask in depression? What question need to ask in anxiety, what question you need to ask in mania patient, because I'm finding that you guys are mixing all the question, which is even not relevant. Okay, you are going to your communication is going to be very, very simple, just like you. I would say even I give to 5 years old to memorize his all question, and he can even do better than us. So this is not a good way to run the station. So better to run the station professionally and use the connector to talk, communicate with the patient. That's why I put the different slides for each station, like for depression, separate, psychosis. Don't want you guys mix it. Okay, let's come up to the alcohol dependent station. The same way you introduce yourself. I just want to have a brief chat regarding established environment regarding your alcohol intake. Is that okay with you? Screening tool we have. Okay. Even in the hospital, practical life, we use two kind of the score, cage or the audit C. So you can follow any one of them. Better go for the cage, which is very, very simple. Have you ever felt that you should cut down on your drinking? So you just start with the screening tool, and then so this can give you idea score over 2, so the problems drinking and need the admission under or the referral to alcoholic specialist. Okay, alcohol intake and impact question. So these are the questions. After you finish the screening tool, then you will go for this question. When did you first notice an increase in the amount of alcohol you were drinking? Then you will go for how often do you drink alcohol? How much do you drink on an average day? Have you ever tried to stop drinking before? Maybe say no, maybe say yes. If say yes, then what happened when you tried? Then you elaborate more close question. Sign of dependence. If you stop drinking, do you notice that you feel down, angry, anxious? If you stop drinking, do you get the shake, sweating, or feel sick, or notice any physical changes? Effect on your daily life? Is it affecting your daily activity? If yes, how it's affecting? Driving, do you currently driving? Because in the end, you need to inform the DVLA. What kind of vehicles do you drive? Alcohol-related crime. Have you ever committed a crime or had the police involved as a result of your drinking? Then depression again question. Psychosis the same way. Risk of harm question. That's it. Same way you go for these all questions, but this patient need, because you're communicating with the patient, so you need to give the plan for the management plan, but you don't need to present finding to examiner. So you'll just say, okay, I'm going to admit you under the alcoholic service, or I'm going to refer you to special alcohol services that will help you how to encounter, or they will help you to cut down your drink. Okay, so this is according to, so you just simply mentioned clinical decision is not a really big deal. The most important in this station is how you run the station. Do you really follow the screening tool or not? This is very important. The bulk of the score is coming from your screening tool about the history you're taking about alcohol. The management, you just quickly make it simple. Just say, I'm going to refer you to special alcoholic services. You need to cut down your drink, and you'll explain why do you need to cut down drink, because it can harm your liver. You can have liver problem later on. Just like a communication, what the complication of alcohol patient will have. Just explain that. That's it. If you have a lot of time. Okay, so this is a very simple station, but you need to be very familiar with the screening tool. Okay, so now we are in this and the depression. I also write down the management of the depression here. Okay, so clinical feature of depression is the feeling down, low mood, disturbed sleep, loss of energy, agitation, slow down, etc. These all you will get in the history. The NICE depression screening tool and classification, they give a PHQ-9 scale for that. But I don't think so. You need to go for it. I just put is if you have a lot of time, but I don't think so you will have time, but you should know about this scale. They use PHQ-9 scales to find out how severe is the depression. Less severe encompass the mild depression, defined as depression scoring less than 16 on the PMHQ scale. So the more severe is around 16. I think total is 29 or 30, probably. So you need to find overall for the purpose of exam is need the special mental health service team admission or referral. Okay, let's come up to Mental Health Act. It says allow compulsory admission of the people who have a mental disorder of the nature or degree that warrant assessment or the treatment in hospital and need to be admitted in interest of their own health or safety or for the protection of other people. In this, you need to use this act, okay? Patient present to you with the depression and he has the risk of self-harm, then need admission. If patient refused to you, go for Mental Health Act. According to it, need a compulsory admission, okay? The same for the risk of self-harm station. That's what was we discussing previous. That's why I say a patient present intend to harm others or harm him or herself again, admit this patient. Okay, so this is again a new piece of less severe depression. You need to go for self-help first line. Self-help first line I will put in the group. Overall, better to refer to mental health services because cognitive behavioral therapy, they will run it, not you. And also counseling. Okay. Psychosis, patient will hallucination, delusion, as we already discussed. Positive and negative facts. The mania, you can check it when you have free time. Generalized anxiety disorder and the risk of self-harm. Okay, so lastly, I want to show you this table. This is a patient health questionnaire 9, and you can see this is a lot of interest. This I just put it, so maybe you wondering what is it, so I just added so you can check out. Overall, you don't need for the examination, for the purpose of exam. Okay, guys, so we finish about the discussion about the psychiatric station and the importance about how to take the history or how to do a mental stat examination. Clear, guys? Any question here?
I just have a question that should I mention about confidentiality in all psychiatric stations?
I think it's not necessarily. As long you, as I said, the most important in mental state examination, patient even doesn't want to talk to you sometimes. So this is very important for risk of self-harm, okay? But not for other stations. You don't need to just skip because you see the already station is a little bit longer. You need to take history, then you need to go for the presenting complaint to examination, so examiner, and also maybe you're required to give a clinical decision. So it's already very long. So better is not avoid that. Just go start. But important is that you need to explain the purpose of meeting. Okay.
Okay. And
can we ask a forensic history, doctor? If the patient have any problem with the police?
Yeah.
That need to ask or no need?
Yeah, you can in risk of self-harm, yes, you need to ask in some station record. I forget to edit, yeah, forensic history maybe record, but not at all. The most important mental state examination and the presenting complaint. It's not required in mental state examination. There is no forensic history, but if you aid it in history taking, so aid it, you can aid this point, no problem. There's nothing about that. Yeah. Any other question?
Yes, Dr. I'm asking about mini-mental examination. If that is a common case in exam or not?
Common station where?
Mini-mental.
Which station, please? I couldn't get you. Could you please say it again? Pardon?
Mini-mental examination.
Mini mental examination. No. That's not really common. That's why I didn't aid it. That's not really common. The commonest station, as I said, the paracetamol. If two stations come up, if one station come up, psychosis or depression, very, very common, very common. But if two stations, they will aid itself on. Because this is very complex station. If you mention the Mental Health Act, this is also can get point, because they want to see you, how's your knowledge. Okay, Mental Act is very important in some point of, because these patients, if the risk of self-harm station comes to you, usually patient doesn't agree with the admission, you know. They will not agree with you about the admission. So you have two choices. Either you check the mental capacity, and if the low risk patient from psychiatric aspect, then you need to discharge this patient. But if a high risk of psychiatric aspects and patient refuse to admission, then you do a compulsory admission under the Mental Health Act. Okay? So they want to check you how you communicate with the patient. So let's,
for example,
yes, yeah.
Just if I am asking patient, for example, for many patient, and while I am asking, he's not answering my questions that related to my questions. Shall I go for next question immediately?
Yes, don't waste time. For
Oh,
London,
okay.
for London died, I don't think so. I had to encounter any patient in any station who doesn't speak. All of them were speaking fluently, very, very clearly, and they were really nice. Yeah, I didn't have any problem with them, and I'm sure that you will not have problem either, because Mrcem is very professional exam. Only if the patient is not very, I would say, if patient is non-native and his or her English is not really good, maybe you can encounter in Malaysia, or maybe you can encounter in India, but I don't think so in the UK. Okay, so guys, and now you see this is a lot to swallow and a lot to focus. So I want to ask you guys, do you want to go for the practice, the role play today, or you want to go for tomorrow? It's up to you. If you think you want to follow this approach, then you can join me. You can go for tomorrow. If you have another approach, you think you have better approach and you're ready, so you can go today, no problem. So I want you do a role play nice, and I don't want. I believe that if I run a role play now, maybe you don't go exactly, or even you run the station very wrong. So I don't want you to do that. So if you're sure, so let's do it tomorrow. We will have 5 stations only. Okay, I want to show you first station, and then I will see who wants to do tomorrow, or how many people are agreed to do it today. So let's see. This is Mr. Ryan, 50 years old, who is worried about him. Mr. Ryan is not been answering phone. This station can come up this way. And take a brief history, perform a mental state examination, explain your finding to examiner. Now you see you have 3 points to do. Take a brief history, perform a mental state examination, explain your finding to examiner. They don't ask you to give the clinical decision reasoning, but if you have time, okay, give the better. Okay, give clinical decision reasoning would be better, but this is the main task. So this likely patient will go to the depression. When you come up to the station, you will know it. Another station we are having, Miss Jane was admitted to observation ward after iron overdose 2 hours ago. Her investigation are all normal. Your colleague wants to give her antidote, but she refused. She would like to go home. So first you will go for the mental state examination. You will see if she is low risk or high risk. Okay. If low risk, then you will go for the medical treatment for antidote. If she refused to go for antidote, then you will assess the mental capacity. If she does have, then you destroy this patient. Clear? But if you found that she's a high risk, she harmed herself and she wants to do again, in that case, she needs admission. Another station I want to show you, this is about the paracetamol. Okay? You have been asked to review her and decide if she's safe to destroy. The same will like RN overdose, but this is a little bit different. Maybe she will agree for an acetylcysteine. Maybe she's high risk, maybe she's low risk. It depends. So it depends on me how I make this station for you. Okay, the next station we have is about unusual behavior. So this can goes to the psychosis. This station with anxiety. Okay, I edit. This is directly come up, but here they want to test you how you approach the patient. Here is Miss Chloe, is a 50-year-old again, and worried about behavior. It can be different ways. Again, you need to perform mental state examination, explain your finding. The last station is about alcohol. So these all stations are important. It's not necessarily you will have 100% like that, but you can have a little different. Overall, the station runs the way I mentioned you. If you run the station the way I mentioned to you in just now, if you run the station that way, I'm sure you will get around 8 to 9 score. Yes, there is one thing I missed, is the forensic history. Yeah, you can edit forensic history if you think. Okay. Yeah, I just missed it quickly. Okay, so forensic history you can edit, but it's not very important. As I said, the important for the exam is two things: mental state examination, your presenting finding to the examiner. That's very important. In between, if you forget one history or if you forget 1 or 2 points, they will not mark it like you missed anything, because those history you can take in even in other stations, so that's not really a big deal. Important how you do the mental state exam and how do you run the station. Don't just go like, okay, you found the depressed patient. Okay, how can I help you? What have brought you today? Okay, can you tell me more about what's wrong with you? This is wrong way to run station. How's your mood? Okay, how's your mood? This is very, just like you memorize something and you just verbalize it. This is not a way of communication. Communication ways, your tone. For example, a patient is depression patient, she is sad, and you're talking like, how's your mood? Okay, what's wrong with you? This is totally incorrect. You need to run a station like this way. I see there's a lot going on around you. Could you please tell me, very, very in pieces, very low tone, could you please a little bit tell me how's your sleep nowadays? Okay, but very soft sound, very soft, that you mentioned that you are with that patient and you are feeling the same way. You have to show the feeling to the patient, and that you can get good score. Otherwise, you're failing this station, I'm sure. Not only you, all you guys will fail if you don't follow. But this Osce exam is actually, you need to be a best actor. The best actor you have to be. Patient, as I say, the patient will present to you inside in the station, like patient, when you will introduce yourself, like, hello, my name is Dr. B. may I confirm your name and age, please? So patient will respond to you in a sad mood, in very low tone. For example, if you ask me, I would say, yeah, my name is Chloe. My sound will be very, tone will be low. And so you can find, and I will look down. In this case, that means this station will go to depression, and you will run a station as a depression. If let's come up to the psychosis. In this case, patient will be restless or irritable. Maybe patient is walking around you. Maybe he has some moment, a kind of, we can say, jerky moment, or he's shivering like that. You will find out. It's irritable. That means this station will go to psychosis, and you will run as a psychosis. And next station, mania, patient will have high volume, a very happy mood. You can find out she will be very excited to you. She will talk very loudly. So that would indicate this station will run as you have to run as mania. Another station you will encounter like anxiety. This patient will be normal as you are encountering in Delhi in the ED, but patient might say maybe she gives you a history of panic attacks. Okay, that's very common in anxiety patient. So again, once you read the case, if you couldn't find what could be the station inside the station, you will know what it would be. So you have to run the station accordingly. Okay, so let's come up. Our first station is okay, I don't want to tell you, so you have to find it by yourself. Okay, so who wants to practice this station?
I want.
Okay, you want. Okay, let's start this. I want to just need to fix this screen first. Or just give me 1 second. I want to tell you one thing, that I'm not a very good actor. Okay, so maybe my acting wouldn't be good, but in the exam everything will be clear to you guys. Okay,
It's okay.
okay.
Okay. I will start. Hello, I'm Dr. Medina. I'm ED registrar. May I confirm your name and age, please?
I'm Chloe. Yeah, I'm 58.
Nice to meet you, Chloe. Actually, I have been told that from your friend you came today to hospital because you are feel that they are worried about your mental health, your friend. Okay, so I want to just speak with you and take some data from you regarding your mental health. Is that okay?
Okay.
Okay. So, Mr. Klo, can you just tell me a little bit more how you have been feeling?
Yeah, I feel very sad, or every day sad.
Mm-hmm. I'm sorry for hearing that. So, how long have you been feeling that way?
For a couple of weeks now.
Okay, sorry for hearing that. So, anything particularly going on recently with you?
Yeah, I left the job, and I lost it, and I am very I don't know why I'm telling you. I feel very sad after that. I lost people whom I work They are very good,
Mhm.
and I really love that job. And since then, I
Mhm.
feel very bad.
Mhm. I'm sorry for hearing that. So are you able to enjoy the thing that is like before?
No, I don't. I can't do anything. I cannot do.
Mhm. Mhm. Sorry for hearing that. So how is your sleep, Mr. Klo? Are you sleeping well?
No, just live for the last few days. I feel all the time very sad. I can't fall asleep. Yeah.
Mhm. Okay. So um, I saw there is a lot of going on around you. Can you manage um to look after yourself and take care of yourself?
No, no, I can't do. I can't do anything.
Mm-hmm. Okay. So how is your appetite? Are you eating good?
I can't eat. I don't feel hungry. Yeah. I all feel
Mm-hmm.
all the way. I feel very sad.
Mm-hmm. Okay. Sorry, I'm sorry, really. So sometimes, Mr. Crow, some people they have some such situation like that. They are trying just to taking drugs or alcohol to just going away from their problem. Is that something you tried?
No,
Mm-hmm. Okay. So, Mr. Pulo, I know that you are feeling it is very bad, but do you have any thought or you try to harm yourself or ending your life?
yeah, I'm very sorry. Yeah, I
Mm-hmm.
I thought about it because I can't pay for my family because I don't have money. Yeah,
Mm-hmm. Okay. What you were trying to do?
I was trying to take some tablets to. Yeah, I thought to do. Well, I'm
Mm-hmm.
sorry. I don't want to do that. I thought it to
Mm-hmm.
do. Yeah.
Mm-hmm. Okay. So, um, now you have not any intention to do it.
No, I will not do it.
Okay. Okay, good. So just have you have any thought to harm other people at any point?
No,
Mm-hmm. Okay. So Mr. Klo, have you been ever um just worried someone interrupt with your thought
no,
or just someone controlling your thought?
no,
Okay. So sometimes just the people um they may hear or see something. Do you just see or hear something abnormal which is cannot explain?
no.
Okay. So, Mr. Kulo, do you know where we are now?
The hospital.
Okay, good. So, what is the time now?
Evening.
Okay. So, who I am?
Doctor.
Okay. So, what do you think wrong with you, Mr. Kulo?
I I don't know. I'm sorry. I don't know.
Okay, no problem. Okay. So, do you think you need any treatment?
Yeah, maybe. Maybe.
Mm-hmm. If there is anything, can I help you today?
Yes. Just help me.
Okay.
What? Yeah.
Okay. Okay. So I want to just to ask you some other questions. Is that okay with you?
Okay.
Do you have any mental or psychological problem before?
Who?
Do you have any past medical history or surgical history?
No.
Do you have any medical problem running in your family?
No.
So what do you do? What do you live, and where do you live, and with whom?
I live alone.
Okay.
With my family.
Okay.
Sorry, with my family. Yeah.
Yeah. Okay. Did you have any problem before with the police?
No.
Okay. Do you have any other questions?
No.
Okay. So thank you for your information, Mr. Kulo. And I want to just to present it my mental examination finding to examiner. So today I just assessed Mr. Kulo. He's 58-year-old man. He presented with mood, with low mood. Before he was have a idea of suicidal, but now he just stopped that idea. He have a stressful background regarding he lost his job recently, so he is feeling low because of that. He have not any thinking to just harm the other people. On examination, his appear he looks sad, and behavior he have just it have to be have poor eye contact according to just the history, and also the psychomotor retardation. His speech is very low and monotonous, and for him, for mood and effect, he described how his mood is low, and also he have lack of sleeping. He described also just his hopelessness, and he feel guilty regarding his friend and some other around him. So he was oriented to the place and time and person. For insight and judgment, just he have a partial insight, and just but he's not believe that is this cognition of guilt and hopelessness could related to his mental health. So Mr. Kulo have no risk for suicidal ideation now. He already stopped that one, and he have not risk also to harm the other. Okay, my management, I saw his low risk. He need just to just see him by mental service, and maybe he need antipsychotic medication. Thank you.
Okay, thank you. Thank you. You did great. The time management a little bit, yeah, it's I think you almost take it more than 8 minutes overall if I see in my phone. So I would say if you practice more and more, it will be shorter. So in the while you will be in the station, you will have 8 minutes. So try to do it a little faster, especially I said you guys the history, which is very short. When you start past medical, you can go very quick. You can go slowly to mental state examination. Important one. Important means the depression question here was a risk, self-harm risk. These question can go slow and can be elaborated deeply, but the rest of question, like perceptual abnormalities or the cognition, you can go faster. Okay, because you need to save the time. And lastly, the presenting finding, please need to work on it, that you need still time to practice. When you practice, you will go very fast. Okay, excellent. The next is thing, this patient is high risk. Actually, when you ask me question, are you going to harm the next time? Yeah, I supposed to say yes. I thought maybe you're asking about intention, so I said no. Okay. Anyway, this patient need a mental health service admission. Okay, not assessment. Why assessment? Because you already assessed the patient with the mental state examination. Psychiatrist will do the same thing. What you did in the EJ, the psychiatrist will do the same. But you are going to refer him for the treatment, for the management, not for the assessment. Assessment you already done. And you found that this patient is high risk or low risk. So you are going to refer. So don't need to say the admission for psychiatric assessment. No, you need the patient record admission for the management under the psychiatric team or under the mental health service. Okay, great. You did a lot better than if we compare with your previous station. Thank you. So who's the next one?
I can do the next case.
Okay. Your tone was really great, and just keep it up. So, do it, Dr. Medina. You're doing very well. Okay, so this is station. Okay, I don't know who said she wants to do. Okay, it's time to do. Let's start, or you need some time.
Yeah, is my voice clear?
Yeah, your voice is okay.
I'm sorry, I couldn't read the scenario. Can I just read this?
Okay.
Okay. Hello, I'm Dr. Mrcem, medical physician. May I know your name and age, please?
Yeah, I'm Vivian, and I am 19.
Okay, nice to meet you. Can you tell me what brought you to the hospital today? I have been told that you have an overdose of medication. Is that correct?
Yeah, that's correct. I came here in hospital, brought by my friends, and yeah, and they kept me here.
Okay.
Yeah, because I took tablets iron. Are you there, doctor? I think she is disconnected. Can you hear me, guys? Is everything is fine from my side? Okay, so she is
Yes, hear you.
okay, so she is disconnected, I guess. So it's okay. So who wants to run this station? Anyone who wants to try this station, guys?
I can do it if nobody.
Okay, but I want to make sure if there's someone,
I can,
guys.
sir. I can do it.
Okay, that's great. So check the scenarios, and then we will come up. Okay.
Yes, sir. Hello, I'm Dr. Mrcem. I'm EDJ staff for today. Can I please confirm your name and ID? Name and age, please.
Yeah, I'm Vivian. I'm 18.
Nice to meet you. I'll just have a brief chat with you. Could you please tell me that what has brought you to the hospital today?
My friend took me here because I took the tablets, iron tablets.
Okay, anything that's said here will be confidential, so you don't need to worry about that. Okay, and I will only share the information if it's really needed. Otherwise, it will be confidential. So even if there are certain difficult questions, I would really appreciate you to answer them. Okay. I'm really sorry for what you did. Can you please tell me? Okay, let's talk about what happened. Like, why did you take tablets?
Yeah, I just angry with my friend. She's my roommate, and I was really angry with her, and I just take it. Yeah.
And how many medicines did you take?
Yeah, 10 tablets.
10 tablets. And where did you get them?
Yeah, it was in the cupboard in my wardrobe.
And it was like you just planned to take it, or it was just an impulse that and you took it without thinking?
Oh no, I just angry with my friend, and I just take it. Yeah, I did no any plan. I haven't did it.
Have you ever thought of doing such thing before?
I know.
Did you take any protective measures before taking these iron tablets, like closing the door or writing any notes?
No.
Can you please tell me that have you ever harmed yourself before?
No.
Can you please tell me that did you were you under the effect of alcohol or any other recreational drug when you took the tablets?
No.
Okay, like you were not under alcohol effect.
No. I haven't taken no
Okay.
alcohol.
And have you ever, and you just told me that you have not harmed yourself before in the past.
No.
Okay. So can you please tell me how has your mood been recently?
I think I'm okay.
Okay. Have you been feeling? Have you felt that you are unable to enjoy the activities that you previously used to enjoy?
Yeah.
And is your sleep normal or any difficulty in your sleep?
No. Just today I was angry with my friend. That's it. The rest of the time I'm okay.
Okay. And how's your appetite?
Okay, fine.
Okay. Have you ever felt that someone is putting thoughts in your head?
No.
Have you ever felt voices inside your head telling you to do something?
No.
So have you ever heard things that others do not?
No.
Okay. I also need to ask you a few more questions. I hope it's all right.
Okay.
Okay. Have you ever had any psychological problems previously?
No.
Do you have any recent ongoing medical problem or past medical problem or surgery done previously?
No.
Any medical problem runs in your family?
No.
Where do you live?
I'm a college student. I live with my roommate.
Okay, in a hostel?
Yeah. In a
Do you
hostel.
smoke or drink alcohol?
Yeah, occasionally.
Occasionally. Or have you ever used any recreational drugs?
No.
Okay, would you like to ask me any questions?
No. I just want to go home, doctor. I don't want to stay here. I'm okay now. I want to go home.
First of all, I need to ask you a few questions. Is that all right? Then I will tell you about that. Okay. Have you felt depressed or hopeless in the past?
No.
Have you ever do you have any plan of eating these tablets or suicide plan in the future?
Doctor, you already asked me now. Come up to management plan. Okay.
Okay. So
I see from psychiatric aspects you are okay. You don't have this ideation. Okay. For the medical point, for the medical point of view, you took overdose to protect to protect your body or to help you with your health. We need to give you antidote because patient refused to take, right? So then you go for mental capacity. Okay. Go ahead.
Okay.
Yeah, come up to management plane.
In the management plan, we will go for the scoring of sad person score now.
Yes, no.
I think I've just lost this one.
Said person, you already gone with the history. You saw no depression. She is young. Okay,
yes.
one is score. It's very already low risk, and she doesn't have any suicidal ideation, etc. She just take it because she was angry with friend. From the psychiatric aspect, she is okay. You saw in the case they mentioned that check it if she is safe to discharge. So only the problem is here antidote of the iron overdose. So your colleague wants to give and she refused. First you need to convince her to take it. But if she refused, then you go for mental capacity assessment and then discharge if she has capacity. Clear?
Yes, but I'm unable to understand how will I check the mental capacity.
Okay, that's good. The 4 points. Okay, I'm coming up to that one. Okay, so Miss Vivian, I see from the psychiatric aspects, so I did the mental state examination, which is not you or low risk, and from that point of view, you are okay. But however, you took the iron overdose, so you might, which is recently you took, so might you develop some symptoms later on. It can be severe, even you can go coma. So what I'm going to do, I have to give you an antidote called diffraxamine. Okay. So how does this sound to you? She said, no, doctor, I want to go home. Then you will say, okay, okay, Miss Vivian, could you please tell me, did you understand what I have just now said? Can you please repeat it for me? Don't you think so it will help your health? To check 2 things: understand, retain, weigh up, and communication. If she has these all 4 things, that means she has capacity. Okay, then after these few questions, then you say, okay, I found that you have capacity. So anyway, I still want you to take this antidote to protect you from severe consequences of the iron overdose. However, you still refuse, so you can go home. But make sure that I give you a printed leaflet and the advice is written there in case you're developing any symptoms like nausea, vomiting, or your condition is going to be worse. Please come back to the ED immediately. Clear?
Yes, sir. Thank you.
Okay,
What's
so
the
if she is high risk, okay, high risk, then she need admission. Okay, high risk, you will find out, as I already talked about Mental Health Act. If she said I will harm myself again, or she has intention to harm others, it still has suicidal ideation, then you need to admit this patient. And if she refuses, then you will explain her that according to Mental Health Act 1983, I think, it's to follow that, or you can say we have special regulation in our hospital to admit you in this case. So you have to, that would be compulsory admission if she still refuses. So far clear? Is I need to explain again.
Yes, it's clear.
Mr.
Yes.
B, just what's the for understand, retain
Excuse
after
me.
the last.
The voice is echoes. Could you please talk one by one? Yeah.
Yes.
Yeah.
Just I am asking regarding capacity assessment. What is the last one? After I will
Understand,
ask the patient to send after me.
understand,
fourth one.
retain, communication, weigh up. These are the 4 points. You can ask even 3, that's enough. You can check the mental capacity. You can Google it by yourself, and these questions, just like, did you understand what I have said just now? Can you please repeat it for me? Could you please tell me, did you understand the risk and benefits if you go home? Okay, so these are the few questions you need to ask the patient. If she give you answer, she said, yes, I understand. Yeah, you said that if I go home, maybe I will develop severe symptoms like nausea, coma, etc. So that means she has capacity. Okay, so you can discharge this patient to follow her, even she refused for the antidote diffraction. Okay, So this is very good station, and this already came an exam in London diet. So I believe that this can come up to any time. So you should be ready for it. Okay, let's come up to the Dr. Mrcem, clear for you the management plan?
Yes,
Because
sir. It's clear. Thank you.
they mentioned already in the case that she refused the antidote and her investigation all normal. So, but she came up earlier, like we say, because the investigation can be normal, can be abnormal. Even paracetamol can be normal in first sight. For example, if she just took the overdose maybe 2 hours ago, right? So investigation can be normal, but you still need to consider antidote for the patient. Okay, let's come up to next station. Who wants to do the next station? Is a similar way, but this would be the paracetamol. Okay,
I will do it.
Who wants to do first? Could you please tell me the name, doctor?
So
Dr. Kashif.
Okay, Dr. Kashif, you do the next one first. First, this ladies should be first. Is that okay for
Okay,
you?
no problem. No problem.
Okay, that's
okay.
good.
Thank you, Dr. Kashif.
Yeah, you are very kind, Dr. Kashif. Thank you very much.
Okay,
Okay, let's
you.
come up to the next station.
Okay, hello, I'm Dr. Tasneem, ED registrar. May I confirm your name and age, please?
Yeah, I'm Wendy. I am 38.
Jane?
I'm Wendy, 38.
Okay, nice to meet you. Okay, I just want to have a brief chat with you, okay? I want to see what's going on with you, and we can work out to help you, if possible, to get out of the hospital, okay?
Okay.
Okay, this might be difficult to talk about it. I wonder if you could tell me by your own word what happened today.
Yeah. I just took 30 paracetamol tablets, and I had a problem with my boyfriend. That's why I took it.
Okay, I'm so sorry to hear that. Okay, you told me you took 30 of the paracetamol tablet, okay? Do you know when you took it? Exactly.
Yeah, a few hours ago.
Okay, you took it a few hours ago. Just can you tell me where did you get this medication?
My mother took it for her headache, and I found in her pouch, and I took it.
Okay. Did you take it just planning to harm yourself?
I don't want to live. I don't. My friend. I don't want my friend and my mother saving.
Okay, I'm so sorry to hear that. Okay, can you tell me just exactly what happened, and tell me if you take any protective measure to take this tablet, like closing the door, or you writing any note for your mother or for your boyfriend or anyone?
No. I thought to write down something for my boyfriend.
Yeah, you wrote for him. Okay. Okay, you took that medication under effect of alcohol? You took it
No.
with some drinks or something?
No, just take it.
Okay. Did you have Any attempt before to harm yourself?
No.
When is that? You remember?
No, I didn't harm myself before.
Oh, this is your first time.
Yeah.
I'm so sorry to hear that. Okay. I want to ask you more question. How's your mood been recently?
I'm I feel very sad after the argument with my boyfriend. I don't know. I just don't want to.
Mm-hmm. It's a difficult relationship. Are you still able to find pleasure in things you used to do, or not?
I don't do anything. I cannot do.
Okay. How's your sleep these days?
Very bad recently.
Okay. I know there's a lot is going on around you. Have you ever managed to look after yourself or not?
I don't do nothing. I'm very shy. Yeah.
I'm sorry. Do you ever see or hear things other people cannot hear or see?
No,
Did you ever feel like someone put idea in your mind or take an idea from your mind?
no.
Okay. Okay. Can you tell me where you are now?
I'm in a hospital.
Okay. What is the time now?
Okay.
It's morning, evening, or night?
Evening.
Evening. Okay. That's good. Who am I? You know who am I?
Yeah, doctor.
Yeah, that's great. Okay, I need to ask you more question. Do you have any mental or psychological problem in your family?
No,
Okay, do you just experience any mental or psychological problem before?
no.
Okay, can you tell me where do you live and with whom now?
I lived before with my boyfriend. Now I don't know. I don't know where I live.
Okay, you are drinking alcohol?
Yeah, sometimes.
You're smoking?
No,
Okay, do you feel do you still feel that you want to end your life?
I don't know. I don't want to stay. I really feel sad. I
Because-
want a baby. Don't want to be.
Okay, you want to go home. I know that, but from my assessment, I think you have high risk to just maybe you will harm yourself again. Okay, and first we should do we should mention your paracetamol overdose. Okay, because if we didn't give you antidote now, that is will harm your liver and you will maybe experience liver failure. Okay, so we need to admit you to just treating this condition now. Is that okay with you or not?
I want to go. I want to go away from here. I don't want to stay in hospital. Just leave me alone.
Okay. You understand what I said to you or not?
Yeah, I understand. You said that you want
Can you
to.
please repeat it for me? Yeah. Tell me.
Yeah, yes, you said that you want to treat my paracetamol overdose because it will be damaged.
Your liver.
What?
Okay. It will damage your liver. Okay.
Yeah.
You understand, and you can just wait the benefit from the treatment and the risk if you leave in hospital now. Yeah.
Just leave me alone, doctor. I don't want to stay in the hospital. I want to go away from here.
Okay. I don't think so. You can go now because you have a high risk to harm yourself again. We are very worried about you and about your health. I need you just to meet some specialist to just make assessment, and maybe he will come with the perfect plan to just help you, and you will feel better about yourself and about what happened in your life or what happened today. Okay.
Okay.
Okay, I will admit you and we will just start managing you, okay?
Okay.
Thank you.
Okay. Thank you very much. What's your name, doctor?
Tasneem.
Okay, that's name. Good try. Actually, this patient is very high risk. You need to start with admission. Okay. You should say you're at high risk to harm yourself. So I need to admit you under the mental health team. And apart from that, I need to treat your paracetamol overdose. And likely you will need an acetylcysteine for that. Okay, then patient say, no, I want to go away from here, and I don't, leave me alone. In this case, you say, we have the law called mental health, that if as you are going to harm, so I need to admit you, but this would be compulsory admission. So you can explain that. Don't need mental capacity assessment. If you do, it's also okay, but you can skip that to save your time, because patient is already high risk if you follow the said person. That's what I say you that before also tell them yesterday, that said person is not really you need to think to follow it. Said person is actually given to the examiner. Maybe he will follow what question you already ask, what you suspect, and they give you according to score. But you can use judgment, like if patient is harming himself or herself again, and they took the overdose, and you see the patient also have depression, so this is very, very high risk, and that's really need admission. Anyway, so you can encounter these states in different ways. Sometimes maybe you need to check the assessment and you can safely discharge. Another time you need admission, and admission can be compulsory. Maybe patient doesn't agree with you for admission. At last, you have to admit under the mental health service. Okay, so good try. Thank you very much, Dr.
Thank you.
Okay.
Tasneem.
Okay, so yeah.
Question?
Yes.
So we don't have to go through the sad person question, all the sad person questions.
This is a sad person question. This depression question are relevant to sad person. And she said she had broke up with her boyfriend. She has problem. That means she is single. Means relationship problem, right? Age can tell you about sad person. Overall, I just want to the assessment of sad person is you're already going on from the history, so you can get idea. So just to do like each point, of course you cannot follow it. Overall, almost all question you already ask from the sad person, like risk of self-harm again, intention to harm others. These all points come up from the sad person. So you already asked this question. So another side, you have a mental health act. That's really indicates compulsory admission, who is going to harm her or himself or going to harm others, and that need compulsory admission. But you don't have to tell about the said person. You already gone in the history, the mental state examination or some question which you ask apart from that. Okay, so let's come up to next station. Who wants to do? Dr. Rafaela is here, and okay, first the Dr. Kashif will do. The next is you. Dr. Kashif, are you there?
Yes, sir.
Okay, that's great. No question. Just now somebody asked me a question. Is that clear for you?
Yes.
About
Yes.
said person, someone asked me, or you can ask me a question again in the end. Okay. Okay, let's come up to the next station. We are going to have it. So in this station, you don't have an idea what it would be. But you can guess from my talking, the way I talk, maybe you can guess what station it would be for you.
Unusual behavior.
Yeah. Okay, you can start now.
Hello, good evening. I am Dr. Kashif, ED registrar. May I confirm your name and age, please?
Yeah, I am Miss Peter. I'm 50-year-old.
Nice to meet you, Mr. Peter. I have been told that you have been brought by your husband with some unusual behavior. Is it so?
Yeah. Yeah.
Okay.
I see something. I see something on the door. Can you see something on the door? On the back of you?
Okay. Could you tell me a little bit more about this feeling?
Yeah, it's on back of you. You can see it next to you or near the door. I see something. Do you see that? Yeah, this one.
Who are they?
Yeah, this is my neighbor.
Okay. What do you think, that they want to harm you?
Yeah, try before harm me and want to. They have something in his hand. He wants to hit me.
How did you find that they want to harm you?
I see this is going to harm me before also.
Okay. Is there any reason you think that they might harm you?
I don't know.
Okay. Do you feel that someone put thoughts in your head or take your thoughts off from your head?
No.
Sometimes people find that their thoughts are being broadcasted louder so that other people can hear them easily. Is that something experienced by you?
Yeah. He want to kill me. So do you hear that? He wants to kill me. Want to hit me with that in his hand, just very long bar.
And do these things talk to you?
Yeah. He said something just now.
Okay. So you are seeing your neighbor and you are hearing their voices also.
Yeah.
Have you ever felt some sensation on your skin that cannot be explained?
No.
Some people face the world around them is not real. Is that something you ever experienced?
No.
With all this going on, have you ever felt low or depressed?
No.
With all this going on, have you ever tried to harm yourself?
No.
Or any thought come in your mind to harm yourself?
No.
Do you know where are we now?
Hospital.
What time is it?
Evening.
Who am I?
Doctor.
What do you think is wrong with you?
Yes, this he won't say. He's there. I hear.
Do you think that you need any treatment?
Don't know.
Is there anything we can do to help you?
Yes, yes. Help me. Help me from this my neighbor. Help me, please.
Okay. I need to ask you some more questions. Is it okay for you?
Okay.
Do you have any past mental illness or psychological problem before?
No.
Any past medical problem?
No.
Any previous surgeries?
No.
Any disease that run in your families?
No.
Are you on any prescribed medication?
No.
Where do you live and with whom do you live with?
I live with my family in a town.
Okay. Do you smoke or drink alcohol?
No.
Do you take any recreational drugs?
No.
Okay. Do you have any questions?
Help me, doctor. This neighbor is dangerous. Or I see him.
Okay, we will try our best to help you. Don't worry. Okay, thank you for your information. Today I assessed Mrs. Peter with the psychosis, most probably schizophrenia. She presented to the ED. She is brought by her husband to the ED while he was listening to some. He was hearing some unusual things, and she was able to see unusual things. She appeared distracted, anxious, and but he engaged well during the assessment. Her speech was monotonous at times, and she appeared stressed and worried. She denied any thought of self-harm, and she described the delusional belief that some of his neighbor want to harm her, beat her, and she denied any broadcasting of thoughts or thought insertion or thought withdrawal. And she has auditory as well as visual hallucinations. And she is oriented in time, place, and person. And Collins appeared to lack insight of her symptoms, being related that it is due to the deterioration of her mental health. I would like to admit her under the mental health team. Thank you.
Excellent, Dr. Kashif. Actually, this station is very stressful. Okay, you don't see me, so this look a little bit normal, but in the exam, when you come in the station, you'll see patient is really nervous, irritable, walking around. You even cannot talk to him in some station sometimes, but however, when you start talking, the patient will engage with you, okay? So when you come in, when you understand this station goes to psychiatry, so you can encounter different station, maybe the depression, maybe the psychosis. So the psychosis, this patient is usually irritable. So we don't have video chat, so you don't see me. Otherwise, you can see me. I maybe show you shivering, maybe the abnormal behavior. So it's okay. My tone is not really very good. However, the psychosis patient, the tone will be like, it will look like the patient is angry with you, right? not happy or not to look depressed even. The tone will be normal, but the expression will really make you like patient is seeing something behind, or maybe patient really try to tell you something very strange, which you or he, which patient is encountering, which is not usual to you. So overall, excellent, great job. So the time management, okay. Few things in the management you still need to work. Not management, actually about the present finding to examiner. That little bit quicker and try to practice more. Okay, excellent. So next station, who wants to try?
Can I ask one question first?
Yeah,
Or two
yeah.
questions?
You
So,
can ask
is that
how many questions you want to ask me in the end. Okay, I will answer to you. Is that okay?
Should I just postpone the question at the end?
Yeah, in the end, we have still 2 more stations, I guess, or maybe 3.
Okay.
After that, you
Okay.
can ask. Okay,
That's fine.
let's go to the next. Who wants to try the next station? Who wants to try this station, guys? Anxiety. It will be
If
mentioned
nobody, I can
exactly.
do.
It's anxiety station. It will be straightforward to you. Not really.
Yeah.
It can be present finding to examiner, or can be the management plan. Just need to give the patient. So it depends how you are going to encounter. Maybe this station can be come in another way. Okay. Anyway, you have to be ready for it. So who wants to try? Apart from lady doctor? Anyone? No one? Okay. So let's go, Dr. Medina. Just, yeah, okay. Oh, Dr. Rafael, he said he wants to try. Is he here?
Okay, it's okay.
Dr. Rafael is a guy. Doctor, do you want to try? I think he's not here. So let's start it, Dr. Medina. Okay, Dr. Medina, let's go.
Okay. Hello, I'm Dr. Medina. I'm Eddie Registrar. May I confirm your name and age, please?
Yes, I am Vivian. I am 38.
Okay, nice to meet you. Okay, so what has brought you to hospital today?
Yeah, I am feeling heart racing. I just would say anxiety, and
Okay.
sometimes sweating.
Okay, I'm sorry for hearing that. So what do you mean by that? Could you just a little bit tell me more about your feeling?
Yeah, it's just started a few weeks ago. My sister, she always with me. She loves me. And, we hang out and had a very terrible accident. And I saw her, she died in front of me. Since then, I'm feeling very bad.
Okay, really, I'm sorry to hear that. So you told me 2 weeks back, your just lovely sister, she passed away by car accident. Is that okay? Is that correct?
Yeah.
I'm really sorry for hear that. Anything I can help now?
Pardon?
Okay. So have you ever had any panic attack?
Yeah, it was like my heart racing. I feel even tingling sensation in my body, and also sweating when I was teenager. But it all goes fine then, because my lovely sister was with me and it was managed very well. But now, yesterday I had once.
Really, I'm sorry to hearing that. So how has it been impacting your life with all this anxiety issue?
Yeah, this problem is affecting my life. My children always say, I'm thinking too much. Maybe I'm worried a lot about.
Okay, I'm really sorry for hearing that. So, how is your sleeping? Are you sleeping good?
Yeah, recently a little bit disturbed. Not sometime very well.
All this going around you, are you taking care of yourself?
Yeah, I do.
Okay, good. So, just how was your mood recently? Is going on?
Yeah, it's okay. It's not that much fine as before, but it's okay.
Okay, so are you enjoying the things that you are doing before?
Yeah, a little bit. Yeah.
Okay. So have you just have any thought to just harm yourself or ending your life?
No.
Okay, good. So any thought just to harming other people?
No.
Okay. Sometimes some people, if they have some situation like that, they are trying to use drug or alcohol. Is that something you are tried?
No.
Okay. Uh, uh, do you think some people they are just putting some idea in your mind or taking some idea from your mind?
No.
Okay, good. So do you just see or hear something the people they are not hearing or seeing?
No.
Okay, good. So just your family now. You told me your kids they are just of course worried about your just your health now. So what do you think that you are your worries is reasonable?
Yes. Yeah, I need a medical help. Yeah.
Okay. So just I will ask you a little more questions. Do you have any psychological problem before or mental
Mm.
problem?
No.
Any medical or surgical history?
No.
Any medical history just running in your family?
No, in my family. Yeah. No.
Okay. So do you drinking alcohol or smoking?
No.
Okay. So do you have any other questions?
No. Just want
Okay.
to help.
Okay. Thank you so much for your information. So I want to present my mental health examination and finding. I assessed today, but her name I forgot actually. So
Vivian.
I assessed today Praveen. She's 30-year-old. She came complained by generalized anxiety, and also that one affect her daily activity and her relationship with her kids. And she have also a history of panic attack multiple times. That background of her sister, she passed away uh, 2 weeks ago due to car accident. So her she's appear anxious and she have a good eye contact and her speech, no abnormality in her speech. And her mood is appear just poor sleep. She told and her mood little bit low. And her thought and perception, she denied any thought disorder or perceptional abnormality. And no risk also to harm herself or other. And from her insight, she have a good insight and judgment. So just my management plan, she need assessment by psychiatric services, and after that discharge home by leaflet and some medication. Thank you.
Okay, great. This patient, yeah, it's also okay, but another is she can take a self-help. You can say either we will try the self-help management plan, like she will get a leaflet and she needs to follow. And also I will arrange a follow-up with the mental health team. So you can say like that, because if patient just has anxiety and she can deal with that leaflet. I forget again yesterday to put it, but I will put the link if I find again. So we give this means how to tackle the situation whenever these thought come, to what you need to do. But and also you need to you forget in the history. Could you please tell me how do you manage, how you cope with this situation? So maybe she can say, I usually watch TV or TV program to forget these feelings, these thoughts. Okay, so you can say like she can tell you like that. So you further need to elaborate more, like a little bit like Odipara, but it's not Odipara. Okay, excellent. So let's come up to next station. It's okay. So who wants to try, guys? Anyone who wants to try the next station? And that's very simple station. Okay, thank you, Dr.
Yes.
Raphael. Okay, I was calling you. I think you lost your connection, or maybe. Okay, anyway, maybe you have got busy schedule. Okay, let's come up to this station. Let's start. Dr. Rafi? I think he lost his connection, maybe. Could you please start it? Can you hear me, guys?
Yes, sir.
I think you mute your mic, or maybe. Dr. Rafael, you can start it. Your mic is mute.
Hello.
Yeah, now it's okay. You can start the station.
Hello, good morning. My name is Dr. Rafi. I am an AD registered. May I confirm your name and age, please?
Yeah, I'm Kaloi. I'm 50 years.
Okay, nice to meet you, Mr. Clay. I hear that you have worried about your wife's behavior. Is that right?
Yeah.
So, would you please tell me more about her behavior?
Actually, Miss Chloe is a woman, okay? So she presented by her husband to you. So you are talking with me now. I am Miss Chloe, so you need to take assessmental examination and take history from me, okay? Not from husband, okay? Let's start again, okay? Okay, you can start now.
So again, good morning. My name is Dr. Rafi. I am an AD registered. May I confirm your name and age, please?
Yeah, I am Kalai. I'm 50.
Nice to meet you, Kalai. How can I help you today?
Thank you, doctor. I don't need any help. I don't know why my husband take me here. I'm really fantastic. I'm feeling great.
Okay, that's very nice. So, please could you tell me why your husband brought you here?
Doctor, I really don't know why he brought me, but I'm always be happy. You see, I look fine. I put on nice clothes, and I have got some very important work. Soon I will have a mission to the space. Bill Nelson, the administrator of the NASA, he is in contact with me, and we are working on project, and probably soon I will. And I'm really happy person. I have always meeting with many people around me. They really love me, and they always want to take photo with me.
Okay, it's a very good news that you have got so much high caliber. So, do you have any past psychiatric history?
No, why should I have any problem? I'm okay. I'm really happy person.
Okay, I can understand. So, what could you please tell me about your mood?
I always happy, doctor. Absolutely fine.
Okay, so could someone feed you in your brain?
No.
Okay, are you seeing something which is not actually present?
No. Why I should say anything like that? Yeah.
Okay, do you have anything? Are you hearing anything which is actually not present?
I know nothing like that, but I have really no.
Okay, so could you please tell me where you are now?
No, I'm in a hospital.
Okay, and what time it is today?
It's evening.
Okay, do you remember me who I am?
Yeah, the good doctor.
Okay, thank you. Are you feeling that you are you have any mental problem?
Why should I have a problem? I'm very famous person. I'm soon going to space, and even the NASA, the administrator, always talk to me about their mission, especially choose me. I'm really a great person. Why I should have this problem?
Okay, so you don't have any medical history, medication history. Are you taking any illicit drug like alcohol or any substance abuse?
I don't have time for that. I'm very busy.
Okay, do you have any family history of any mental health?
No.
Where do you live and with whom you are living?
I live with my husband. Yeah.
And who take care of you? Yourself?
I am very healthy person, and nobody. I take care of myself. Yeah.
Okay. So thank you very much for giving me the information. So you told me that you are a very high caliber person and you are enjoying your life as you mentioned. So based on the information given, so you have a mental problem with the name of mania. Have you heard about that?
You need to present finding to examine.
So this is a 50-year-old McLoy presented to me with the with the flight of ideas, and he denies any psychiatric problem, as well as he denies any medical history, any illicit drug history, and he has got a flight of ideas. And with the pressure of speech. So based on the history and mental health examination, I suspect that she is suffering from a condition which is with the name of mania. So for that, we have to treat her. We have to refer her to a psychiatrist for management.
Okay, thank you very much. You could try. Actually, this station is that's correct, Hispania, but your approach, your question about relevant you haven't asked, you skip totally mental state examination, which you're supposed to do it very well to get at least 5 or 6 score, which you lost at almost. So try to work on it. Okay, mental state examination, it's very important. Two things are very important in psychiatry: mental state examination and the clinical finding to the examiner. If you don't do well, you will lose almost entire score. So you still need to work a lot on it and try to before practice you need to revise the tables which has been given in previous. Okay, so you have to go make your approach better. Okay, so thank you very much, guys. Today it was our last station, I guess, so far. Let me, oh no, we still have one more station. Alcohol, yeah. So who wants to do this station? That's very simple station, and you just follow the, okay, thank you. Okay, you want to do, right? Okay.
Yes.
Okay.
I
You can
didn't
start.
read the scenario.
You want
I
to
will
go?
read the scenario.
Okay.
Okay. Hello, I'm Dr. Tasneem, ED registrar. May I confirm your name and age, please?
Yeah. I am Colin. I'm 60.
Okay, nice to meet you. I just want to brief chatting with you regarding your alcohol intake. Is that okay with you?
Okay.
Okay. Have you ever felt that you should cut down on your drinking?
Yeah, I did.
Okay. Do you get angry if people mention your drinking?
Yeah, when sometimes when they do, yeah, I feel really angry and stressed.
Okay. Do you feel guilty about your drinking?
Yeah, ever since for the last 2 days, I'm feeling that. Yeah.
Okay. Have you ever had a drink first thing in the morning, just to calm yourself or to just get steady and starting the day?
Yeah, but I cannot. My day cannot go without drinking. That's correct.
Okay, and just can you tell me more? When did you first notice that you increasing amount of alcohol you were drinking?
The last 5 days after settling in the business.
Okay, just in the last 5 days. Okay, how often do you drink alcohol?
Maybe 4 times a day.
Every day, just 4 times. Can you tell me how many cup or how many unit per day?
I never seen how many cup whenever I feel I have to take the alcohol.
Okay. Have you ever tried to stop drinking before?
No.
Okay. Have you ever felt like alcohol is affecting in your daily activity?
I haven't. Yeah, I would say sometimes.
Okay. If you stop drinking, did you notice any feeling, just weird feeling? You just feel like you're angry or anxious?
Yeah, that's right. My whole day goes worse if I don't drink. I have noticed from last 3 days.
Mm, okay. Do you ever also feel if you didn't drink, you get shaky, or you have some sweating, or
Yeah,
you notice any physical change?
yeah. But I just now, I really need a drink to drink. I still feel that.
Okay. Do you currently drive?
No,
Okay. Have you ever before have any problem with the police because you're drinking?
no.
No. Okay. I need to ask you more question. Can you tell me how's your mood been recently?
Okay.
Do you feel like someone put an idea in your mind or take an idea from your mind?
No,
Do you hear or see something weird other cannot see?
no,
Did you ever just try to harm yourself?
no,
You didn't think before like hurting others because you are drinking or something like that?
pardon?
You didn't think before to hurting other also?
No,
Okay, I need to ask you more questions now. Okay, do you have any mental issue before?
no,
Any medical disease?
no,
Any medical problem run in your family?
no,
You have an allergy for any medication?
no.
Okay, can you tell me where do you live now?
Live with my live with my family.
Okay, what do you do for living?
I have business, but I lost it.
Okay, do you smoke?
Sometimes.
Do you take in any recreational drug?
No.
Okay, do you have any question for me?
No, doctor. Thank you.
Okay, thank you for your information. Okay, according to your information, you have now just shaky body and you have sweating. All these symptoms of alcohol withdrawal. Okay, and according to to the screen tool that I did it for you, you have high dependence for alcohol. Okay, you know that alcohol, it will affect your heart, it will increase your blood pressure, it will affect your liver, it will destroy all your body. So that's harmful for you. Okay. I just recommend you to go and to see a specialist alcohol service. Okay, and maybe they will put you in a program to planning with to help you planning in alcohol cut down. Okay, and they will just help you to be better. Okay.
Okay.
Okay. Thank you.
Excellent, Dr. Taslim. You did very well. Okay.
Thank
So
you.
just a little bit faster, and your management plan is also very good. You need to refer to the alcohol specialist. And first you need to confirm, would you like to cut down your alcohol? Is it's affecting your daily activities? It's very harmful for your health. It can cause liver failure and other symptoms you have to tell him, and then encourage him. And the patient will agree with you. Okay. But if he do not, if patient doesn't agree, then you need to check the mental capacity if he has a distortion. Okay, thank you very much. It was a great webinar. I think I found many of you guys are really progressing very well. And till your exam, I'm sure you will be ready. Special thanks to everyone who has participated. The guys, the problem is that when you need to be very careful during the webinar. You don't need to control your you always need to keep your mic closed, mute your mic, because it's very difficult for me to remove those voices sometimes. So if you do like that, then I cannot record it. I mean, the recording will be disturbed. Okay, so try to avoid those things. And marking on the screen is also not okay. I am not doing by myself even, because I want the recording should be crystal clear to you, that you can read each word. The table, you can read it very well, and you can note the point. Okay, so try to avoid that. Okay, there was someone who wants to ask me a question.
Dr. B, I have one question.
Yeah.
As in my case of schizophrenia, the patient was continuously asking that you can see, you can hear also. What should I reply in that case to her?
You don't have to reply anything. You need to continue for questions. Okay.
That's good. Thank you.
Yeah. You need, first is that you will not have time. You don't need. You need to ask the question relevant to. Like he said, I see something. You need to ask him, what do you say? Who is there? How many? If people say there is my neighbor, okay, how many? Is he or she? Then what your neighbor wants to do? Is he saying something to you? But I want to tell you, this patient, usually in the station, he's continuously talking. Maybe he is talking, he's hearing voice, and maybe he says something. Oh, like, unusual voice. Problem is that we are not having this station on the video. Otherwise, I can show you how it looks like. So